video to show you how to clean an incision after a facelift. And what I'm trying to show you here is really trying to take down the fear level of just cleaning it, because a day one or day two after a procedure, you come in here and you're really a little bit worried. How do you clean it? How did, I had my assistant show you and you can't remember. So hopefully this little video instruction will show you what the incision is like, and maybe even for a prospective patient to review this material in advance could be instructive. If you see, this is about 2 days after the procedure. There's a little bunchiness here and little indentations. All that will clear out in about 2 weeks at the most, 1 week at the minimum, somewhere around that. And every day that goes by, it'll start clearing out. And actually, this is a revision facelift. This nice lady had it done about 10 years ago. And what I really worked hard, and I think it's fun before we start talking about the incision, is what I did to try to modify this incision, because it's a bit atypical. This was really thick, this tragus area, and it didn't look quite natural. So I worked to really thin this out and make a dent in here and actually suture down that dent. You need a dent here. If this thing here is just really thick, it just doesn't look natural. So I really worked to bring that area down. The other thing that's so important when you're looking at a facelift incision is that it should not be straight down. And this incision previously from here to here was just one straight shot. And so I regularized it, made your eye hopefully a little bit harder to see. I always say it's difficult to predict this when it's scar suture to scar, but I worked really hard to make sure this would look better. And so it curves this way, then 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 curves that way. The other thing you're seeing here that you barely can see is this little 2mm limb. And the only reason that was there is that this nice lady had a little bit of a pixie deformity where the earlobe actually was elongated and pulled down. So I actually had to shorten her earlobe on this side. This little incision will disappear, and if it's even slightly visible, I'll be able to dermabrate it. But the key is getting a good position of the earlobe. And as it goes back here, you see her hair is pulled back. None of the incisions go way down low, but it ends a little bit higher up here, and this is all, the incision crosses where the helix, which is this part of the ear right here, folds back. So those are little things, and you can see actually the incision here in the front ends right here. So no hair is removed anywhere, and the naked scalp down here is kept, naked without an incision, so that you don't have a problem with wearing your hair back and having visibility, or having that weird step-off deformity where you can actually see the hair look abnormal when it's pulled back, and you can actually see this little crease in it. All those little things make a huge difference. When I close this incision, also it's all done under 2.5 magnification, so very, very fine closures as we go across here. The sutures behind the ear are 5-ochromic suture, which means they dissolve, and it takes about 2 weeks for that to heal. So those sutures really won't be removed, but about 2 weeks out, I'll take a look at it and see if there's any remaining sutures, and I'll just sort of clean that up. But these sutures will be taken out at a week, the ones in front of the ear. So what's really important in the cleaning, it's best to clean the entire area, but say like you don't have a significant other or someone that could help you with, or a care provider, and you're really worried about this incision back here, I would say that don't worry too much. You can go ahead and clean the front of the ear and you're going to be okay. But obviously in an ideal situation, all of this is cleaned, and that's going to be an ideal situation, but I don't want you to panic if you can't quite see behind here. If you don't have someone to clean it for you, it's really going to heal quite well regardless. The way to clean this, and I'm using my left hand, so it's a little bit awkward here trying to film and also clean this. And the key with this is a peroxide-soaked Q-tip. You never want to re-dip or double dip. Remember the Seinfeld episode? This is the same thing, except not applying to chips here. So don't double dip, otherwise it gets contaminated. Then you take this and you just gently clean it. And the key with this is not being abrasive. Treat it with kid gloves. This is a very delicate incision, and you're going to see some of the blood come off. And if you don't get all the blood off the first time, don't worry. It's actually totally fine. I would rather you sort of take your time and get the blood off. The reason you don't want to have a lot of blood on there, and there's really not blood on this incision, which is nice, is that the blood can actually serve as a bacterial medium or culture medium where you can get an infection or something like that. But again, that's so rare that I don't want you to panic even when I say that, because it's actually going to heal tremendously well. But the key with this is just gently, just roll it even. You can soak up the Q-tip with the peroxide and just clean it. After you've cleaned it, and you want to do that twice a day, not more than twice a day, just a couple times a day. And a lot of people are tempted, well, if 2 times is good, maybe 6 is better. And actually that's not correct. You just want to do it a couple times a day. And after you've cleaned it a couple times, then what you want to do is keep it moist. And this is the real key. Now, even though I just said, this is, by the way, bacitracin. You can also use non-antibiotic solution. You can, in some people, about 5% get an allergic reaction. In my video about wound care, I talk about that. If you do get a really itchy red reaction about 48 to 72 hours after application of this, you want to let me know, and then I can stop it. And really, the main thing is communicating with me and always making sure that you and I are in dialogue to make sure there's no questions or problems. But you're going to go ahead and liberally apply this. I didn't really do a lot of it on here because, again, I'm sort of without staff today, and I'm just doing this with my left hand, so it's a little bit odd here trying to do this and film it. But you want to really keep this moist. And even though I said to clean it twice with a peroxide, you really want to liberally apply this. I mean, this has got to be glistening moist, and that will really help it heal well. I just answered this question on my form about how to let a wound heal well, and there was this question of whether to let it scab over, and that's absolutely wrong. You want to keep this so moist, and even though I said clean it twice a day with the peroxide, you want to keep it really liberally moist. So even if you err on the side of too moist, there's no such thing. Now, once the sutures come out at day 7, again, those are going to be the sutures in front of the ear, we're done, okay? So there's no more cleaning, and you're going to feel naked. You're going to feel like, I need to do something. Can I put something on it? My best friend told me to put vitamin E. My best friend told me to put aloe vera. What I would like to suggest to you is just leave it alone. And the problem is there's some recent studies, and I mentioned that in one of my FAQ section, that vitamin E can actually be detrimental to wound healing. And I don't know if that's actually the case. I was using vitamin E for many years and really had no problem with it, but I'm just trying to keep up with the literature and go by what the latest comments are. So hopefully that's a little bit of a summary. Remember, just for the sake of completeness, that there's going to be an incision on the other side, the same, and there's a tiny one underneath the neck, and we're not going to really show how to clean that. It's pretty obvious and self-explanatory, but hopefully this was a good explanation for you. Just hearing my voice and listening to me and talk a little bit about how to clean the incision from a close-up photograph or close-up video will hopefully take a little of the fear out of cleaning, especially if you don't have a significant other present to help you with this task.